Hi everybody and welcome back to Health, Fitness and Science. In this video I'll tell you about the extraordinary findings of a scientific study, which demonstrate that vitamin D is effective in treating COVID-19 patients. A very important study, conducted in Barcelona, Spain, evaluated the effects of vitamin D supplements on COVID-19 patients. The results from this study have shown that vitamin D is effective in reducing the number of patients requiring intensive care unit admission, and the number of deaths due to COVID-19. Before we talk about these very significant results in detail, I want to explain to you a bit about vitamin D, so you can understand the results from this study better. Now, it is important to know that cholecalciferol, commonly called vitamin D3, represents the best form of vitamin D for humans. Vitamin D3 can be manufactured in the skin through sunlight exposure. But in cases where there is insufficient sunlight exposure, vitamin D deficiency occurs as a result. In these cases supplements are necessary to prevent vitamin D deficiency, because food contains very little amount of vitamin D. Also, it is important to know that cholecalciferol needs to be transformed by the body into the active form, by the liver and the kidneys. First, cholecalciferol is transported to the liver, via the blood circulation, when it is converted into calcifediol. This is the form of vitamin D that is tested to assess blood levels. Subsequently, calcifediol reaches the kidneys through the blood circulation, where it is converted into calcitriol, which is the active form. Vitamin D is referred as vitamin, but in reality it is a hormone, which is essential for many biological processes, including immune modulation and function. Now that I have told you a bit about vitamin D, let's see the results of the study in detail. The study included 930 COVID-19 patients with severe symptoms, who were already admitted to the hospital. Patients were randomly divided into two groups. One group received standards treatment and calcifediol treatment. As I explained to you, this is a partially metabolized form of vitamin D. The doses were as follows. The same day of admission to the hospital, these patients received 532 micrograms of calcifediol. And on day 3, 7, 15, and 30, patients received 266 micrograms of calcifediol treatment. In the control group, patients received standard treatment, but they did not receive calcifediol treatment. It should be noted that the scientists treated patients as soon as they were admitted to the hospital with calcifediol instead of cholecalciferol, because this form of vitamin D is already partially metabolized, and the body converts it faster to the active form. In doing so, the treatment acted quickly and helped to prevent the COVID-19 symptoms from getting worse. You should consider that the percentage of intensive care unit admissions and deaths from COVID-19 reported in this study does not reflect the general population, because in the general population there is a variety of responses to COVID-19, ranging from asymptomatic to mild or severe symptoms. But in this study only patients with severe COVID-19 symptoms were included. Okay, once we have pointed out this difference, let's look at the findings. The results from this study demonstrated that calcifediol treatment reduced significantly the number of patients requiring intensive care unit admission, compared with patients who did not receive calcifediol. As you can see in the table shown here, 5.4% of patients who received calcifediol treatment required admission to the intensive care unit, and 21.1% of patients who did not receive calcifediol treatment required admission to the intensive care unit. Importantly, calcifediol also decreased the number of deaths due to COVID-19. As you can see in the table shown here, 6.5% of patients who received calcifediol treatment died, whereas 15% of patients who did not receive calcifediol treatment died. This means that calcifediol treatment reduced the risk of death by 64%. No adverse effects of calcifediol treatment were reported. These findings are extremely important, and demonstrate the key role of vitamin D in treating COVID-19 patients. Also, this study demonstrated that vitamin D treatment is safe, because no adverse effects were reported. In contrast, medications very often have various contraindications and side effects. This means that vitamin D treatment is high benefits and low risk. What not to like about it? The scientists who conducted this study concluded that in patients hospitalized with COVID-19, Calciferol treatment at the time of hospitalization significantly reduced intensive care unit admissions and mortality. Consequently, it is essential to include calciferol within the treatments for patients with COVID-19. These results are in accordance with those from previous studies, which demonstrated that vitamin D is very important for preventing and treating COVID-19. Thanks for watching and bye for now.